their endurance actually. Okay.
No, the side is carrying 8 sand.
Yeah.
So if you want to do more kilometers like it is always good to give that.
Yeah, of course. No issues. You have to know the one's endurance, one person endurance, how long he can do it.
No, sir. They are coming from different sports.
Okay.
There it is coming and building. Specific course endurance, what is the endurance?
Yes. But we need to know their background actually. We need to know their background.
What measurements, what safety, what safety measures.
They are going for a long endurance swimming kind of a thing, like as he's saying 240 laps of a 25-meter pool. That's almost what happens there is it takes almost 3 hours to do that. Start at 3 o'clock in the afternoon, by the time they finish it is almost 6 o'clock, and they're continuously swimming during that time. So basically what he wants to know is it safe to swim for such sustained lengths of time? Especially
Yes, there is no.
Basically we know, we observe outside is parking, but inside what happens we don't. They just limits.
Yeah. So you are the better judge in knowing his limits, because a coach can know about one person's limitations. Okay, we have to know about what is his limitation. If he has done it priorly, without any exhaustion, without any strain, definitely we can allow him to go for a longer laps or longer duration of any swimming. If he is not able to that time, definitely he is not able. Suppose he is doing 1 kilometer without any strain. Yeah, definitely we can allow him for a second for a 2 kilometers. There is no restriction on it. So his endurance, his capacity is most important. That one you can do. If he is doing it, no problem.
I am observing external, but there are many incidents. I think in our Bangalore, Iran goalkeeper, he died. Yes. But he is physically very strong. Some cricket players also quite very strong.
That is why I said that is why I said in endurance. If he has done 1 kilometer without any problem, without any chest pain, without any exhaustion, he is liable, he can do it. If he is not able to do that 1 kilometer, we cannot push him to the 2 kilometers.
The struggle is to
Yes.
you are already laps, you will start. Afterwards, you take off.
Yes.
I have one child. Overweight, huge, strength. Still that he can run or jog.
Definitely he can it is not because of the fat so far he is very good sprinter. He is a very good sprinter. So why I am doing this? One has gotten his own ability, he has got his own capacity. If he has got that one endurance completely, definitely you can make it run, you can walk. So he has got it. If you can even have the stamina, you will have a stamina.
If overweight is running, maybe his knee and ankle can be.
That can reduce his weight. If you start allowing him to walk or run, see at this age you do not need not get very weight. He has got enough time. The kids, whether it is an overweight or what, 140 or 130, if you allow them to run or to do something, they will do this. And he will not get injured at this young age. It will take many years to do. It will take many years to do. Definitely he can do it. Definitely. Provided he has got a good choice. If you see, he is very free, he is doing all exercises, he has done everything, he has done his relaxation completely, he is stretching everything, he can do it.
Sir, the all sir airs in surgery.
That is what I said. Nothing. It depends upon what is his priority, what is his, whether what type of player is amateur, or whether he is going to be just, the weekend or something. But if it is only in his field care, we will leave it to him. Okay. Whether he can get a surgery or not. Why we advise surgery? Because the ligament is such a way that we have done enough studies to show that if the ligament surgery is not done, see God has given 2 ligaments, right? ACL and PCL. Why it is important? Each has got its own important. It's not like a tailbone where you take it out, not a problem. It's not like an appendix, you take out nothing. It is a ligament constantly which is there to support the one movement, the forward flexion. Suppose if you do a forward flexion, you can able to do it, no problem, without any reconstruction. Outside structures, outside muscles are covered, no problem. But over a period of time, there will be micro motion actually within the joint. This micro motion is sufficient for the ligament, for the knee joint to get a wear and tear. The femur or the tibia can cause a wear and tear inside. Not only that, if it exceeds, if it happens again, if he gets instability again, what will happen? He had only instability. He will develop ACL plus meniscus.
He keeps strengthening the muscle and maintain the rhythm and is not going to be a professional player.
Yeah.
Avoid and leave a normal time.
He can avoid it, he can leave it, provided he is not playing, he is not being in the activities. Because we do not know when he gets injured. If he gets injured, he is going to get injured very badly again. He is going to lose his meniscus, okay, which is supporting, which is important structure in the body. Because all these years they were not giving importance to the meniscus. Because now the meniscus is the most important, we come across, we know it, and how it plays an important role in protecting the knee. Fine? So when that happens, definitely you are losing the important structure, and what the damage has caused, you might have solved it priorly before giving it reconstruction.
In the longer run, it will not affect his
It will not affect it. So by giving a reconstruction, at least you are saving his joint. That is why you do. Young athletes, no, definitely needs it. But over a period of 40 plus, if you think about 40 plus, is got injured, then we leave it to you. If another 10 years is there, you don't have to be a problem. If it depends upon the game, whether you have to play. If you still, some people, again, it depends. Okay, some people will play without any problem, but some people, this simple ACL, they will not be able to play because for them it's vital. Again, the criteria is different. Then we will analyze why he needs it. Some of the criteria are there. If the slope of the tibia, what we call, if it's very less, he will have more instability. If it is normal, if it is more, if the slope is more, he will have a good instability, a good stability. You don't need ACL. So, judging is definitely important, and analyzing the criteria is also important to put into a surgery.
Sir, this
See, you are cutting complex of intelligence. This is because you neglect the ACL there. It's not an injury, it's a mold injury. This mold injury is because a regular you might have had repetitive injury, slip again, that has caused the meniscus to rotate out. And the has got bucket and meniscus. Bucket means from the front to the back, the meniscus is completely out. And it has come out of this place. It has not become two bones. So, this is the one definitely case of intervention. Because what happens is this meniscus over a period of time become a cage again. It becomes hard. Once it becomes a hard substance, it will become I have a video that showed you how the effect happens. Meniscus gets degenerated. It will become a hard bone and it will start working on the femur. So you lose the cartilage. It gets really bare. You will not have any instability. We have a bucket. We have a bucket and a you will not get instability. You will walk. You will do at this stage, you need to see definitely you will be able to play, you will be able to run, but what will you be?
Sir, we have a bowling machine. Yes. This machine is operated at a very high speed, like 100 km per hour, 120, depending on the size of the leg, under 40 and 50. Sometimes we face a situation when the ball makes an impact on the player, so that's when we hit it high, or the ground,
Yeah.
and he was like literally unable to breathe. In that situation, what precautions should be taken? Because now those walls actually not leather walls. Stairs walls which are really hard material. So I've seen one more incident, a lady was lying, the boy literally fell on the ground and his mouth open. He is unable to speak. And in that situation, what care, what precautions, or what medication given immediately?
Some of these injuries can be fatal also because we do not know the impact. See, every patient or every person will have a different pain threshold. For some people, a small injection I cannot take injection. I don't know. Because for me, injection, I'm very scared. Become a big doctor. If somebody is showing injection only, I'll think about So like, people are there who are really very low threshold. For them, the suddenly sympathetic stimulation, what we call. Okay. So that will go shoot up. If you get shoot up, you will get a high blood pressure. That itself is sufficient for the heart not to take the breath. It will suddenly stop. So in that situation, what we do is immediately we make them lie on flat, allow them to speak, allow them to breathe properly. No water. Shouldn't give any water. If you are giving a water, give a water and turn it to one side, to the side. So it's not aspirate. Fine? Because if you don't know whether he is conscious or whether he doesn't know, though he may be awake, but he will not be literally, the patient will not be knowing what is happening around him. He can aspirate. So we have to very judiciously, we need to give him a water. The first problem everybody does is the main is give him, they give a water. Allow him to drink water. He doesn't need a water. He doesn't need a drink. Air. So allow him to get it and allow the heart to pump. Just 2 or 3 pumps over the chest. Do not really break, it will not break. Even if it breaks, it's good. Because this will stimulate the heart. So I have broken many ribs. While resuscitating, they have broken. That doesn't mean that we need to give so much of heart, but I am telling the heart stimulating is important rather than we are just thinking about it may cause pain. So giving a good fresh air, allow people to just go around, go away from it, let him relax, and the leg should be elevated. Why? Because that stimuli, what happened at that moment, when the heart will not pump, you don't have the backflow. We need a backflow. So elevate, put him into the leg should be elevated so that the blood flows back to the heart, and then you can allow for the breathing. I have seen very recently, a year back, we were playing shuttle badminton at night times. There was a different apartment, the tournament was going on. Same thing happened. One guy was playing, suddenly he has not had food. He didn't have any food, he was playing and totally exhausted himself and went back and fell down. And we were, and myself and my doctor, we were now speaking, we were not doing it. Suddenly everybody rushed and he was not speaking, he was totally flat. No pulse, no respiration. So we have to revive him on the spot, took him out, put the leg elevation, we gave him a nice resuscitation. I think next time we should report. So that is a very important actually. Okay. How to resuscitate is most important when you solve it.
They got a specialist, we will have that first aid and CPR training.
We got a specialist, and that will be very important. It's very important to know what exactly you should do in the field like this will happen. So they resuscitate and he got into that. Similarly happened 2 weeks later, the same field. Unfortunately that day I was there, the second day I was not there. I was really surprised to know that fellow died. Luckily for that day I was there. Because these sympathetic stimulation are very notorious. Anything can happen. See, that is why the people who are not unaccustomed, when you try